Hi, everyone. My name is John Faulkner, and I'm your host of the Smarter Systems, Better Care podcast. I'm here today with Dr. Alaina Brinley-Rajagopal, and she's a co-founder and chief medical officer at Esperto Medical. Thank you for joining us today.
Thank you for having me.
Absolutely. And just to give our listeners the backstory, how did you get here today? And what are you building right now?
I guess I started off as kind of a general biologist. I worked in a lot of different fields, ranging from astrobiology to paleontology, and then decided I wanted to go to graduate school to study space life sciences. So my degree was a PhD in public health, virology, and space life sciences. And so I did all of my PhD research at Johnson Space Center, studying viral reactivation and spaceflight. But about halfway through that, decided I wanted to go to medical school so that I could kind of understand the human body as a whole better. And so went to medical school after I finished my PhD and then decided to do residency in emergency medicine. So I'm currently boarded in emergency medicine, but I was really interested in practicing medicine in environments where it's really difficult to practice. So I did a lot of global health and kind of wilderness medicine, aerospace medicine. And so combining all of these different things really got me thinking about how we can improve medical diagnostics in those environments. And so that kind of got me interested in medical devices. And so then I started talking to my husband and co-founder, who fortunately is a physicist and engineer, about how we could improve some of those technologies. And so that kind of led us down a path to ultrasound and then blood pressure and ultimately to the method called resonance sonomanometry that we use to measure blood pressure continuously, non-invasively, and without calibration.
Excellent. And then do you mind kind of expanding more on wilderness medicine? I heard you mention that.
Yeah. So there are a lot of people who recreate outdoors and often can get into really difficult situations. And so it's really helpful when you can have providers who have sort of advanced medical skills to help with some of those rescues or, to even just be in those environments. Like in Mount Everest, for example, there's a base camp hospital where physicians work and really work to treat climbers who are sick or have gotten injured very quickly. And so it's kind of, I like to say austere medicine. So the practice of medicine anywhere where it's difficult, whether that's, Everest Base Camp or a remote island or even the moon.
That's amazing. Do you have any good stories that you've had in the past or recent experiences you'd like to share specifically?
Yeah, there's a lot of personal experiences. I also love to climb mountains. So I guess one I could tell you was my husband and I were climbing Mount Whitney once, and he slipped on some ice and dislocated his shoulder. So I was able to reduce it right there on the side of the mountain. And then when we got back kind of down to civilization the next day and went to get it x-rayed, the doctor didn't believe that it had been dislocated. He was like, "Are you sure? It was really," and I was like, "Yes, I'm positive I felt the pop."
Did a great job putting it back.
Yeah. So good thing if you're clumsy, just marry a doctor and
Yeah.
climb with them.
And in looking kind of in the wilderness medicine, at Esperto Medical, what kind of solutions do you provide to your patients and people that you work with specifically?
So I guess I like to think about how we can prevent a lot of accidents or diseases or things from developing in the future. And sometimes challenges with prevention are related to just having enough information. So when we think about cardiovascular health, there's not a lot of information the average person can get to really measure their cardiovascular health beyond, a blood pressure cuff at home where they're looking at maybe once a week taking a blood pressure. And so we really started thinking about ways that we could improve cardiovascular monitoring to provide practitioners in hospitals, but also people outside of hospitals with more information that can sort of empower them to better control of their health.
Is this a form of basically remote telemetry or some kind of monitoring? Is that part of that solution?
Yes, so we invented a method called resonance sonomanometry. So it's based in ultrasound. And so basically we're continuously looking at blood vessels with ultrasound, but we also use audio frequency sound through a bone
Okay.
conduction headphone or something similar to that. And when you apply that sound, it actually induces a resonance in the wall of the artery, similar to when you pluck a guitar string, for example, how
Interesting. Yeah.
tense the guitar string is causes the change in tone. It's kind of a similar thing with arteries. So using those different types of sound, we can measure different parameters on the blood vessel. And then when we combine those, we can actually calculate blood pressure about 100 times a second. And so we get a full continuous
Wow.
arterial waveform similar to what you would get from an arterial catheter, which is an invasive method of measuring blood pressure. And we can also measure your arterial wall thickness and your arterial stiffness and your arterial radius in real time and continuously. So you can look at how different foods or stress or other things that happen during the day can affect your cardiovascular fitness.
And then how long have you been working on this and developing it?
A while. It kind of took us a little bit from the time I came back from a trip to really start talking about how we could make something like this a reality. Because my original request was I wanted a tricorder. I don't know if you're familiar with Star Trek at all, but it's this magical device. They just wave over a patient and it tells you what's wrong. And my husband was kind of like, well, why don't we just build one? And that was my response. I laughed. But we started thinking about it and realized ultrasound is a really versatile tool. You can use it in a lot of different ways. But the challenge with ultrasound is it's kind of hard to learn how to use. So we started thinking about how we could automate things to make it easier for people to use without extensive training. And then that kind of led us down the path to blood pressure as a easy first project that ended up not being very easy. We developed a couple of methods that we ended up throwing away because we felt like they just weren't good enough, using like blood velocity and things like that. And ultimately, kind of after going back to the drawing board again, realized that resonant sonomanometry is probably the best way that we could do this. And so then, we set out to demonstrate that it was effective in like fluid-filled balloons. And when it worked there, we moved on into measurements in people and developing the device and making the device itself easier to use.
Excellent. Is this on the market today or is this still in development right now?
Still in development. Yeah.
What kind of feedback are you getting from other providers you're demoing this to, or are you at that stage yet where you're kind of piloting things?
Yeah. We actually were just talking to another clinician last week, and I think his exact words were, this is going to change the way that we practice medicine.
Wow.
So that's really exciting. And I think there's so many ways that the technology can be applied that we haven't even thought of yet. So, once we actually have the device, I think what really excites me most is just what we'll be able to discover with it and learn about human physiology, because the device works on any artery visible to ultrasound. So we could put a device on the carotid artery, which is a central artery, and we could also put another device on the brachial artery, which is a peripheral artery. And we can look at how your central arteries are differing from your peripheral arteries. And all of these things can really teach us a lot about cardiovascular physiology, but also a patient's unique individual physiology. So I think a lot of really, really cool things can be discovered based on that.
Yeah, sounds like it. And you said it takes it about 300 times a second when
About
it's
100 times a second.
100 times a second. Okay. What's the advantage? I get, because looking at the current way right now, it's like taking it basically one time a minute or however long it takes to
Like
run through the normal
once a
process.
week, once a month.
Yeah. But what's the advantage from a physician standpoint, such as yourself, of getting it constant that many times so quickly? Is it about looking at trends and things over time and then
Yeah,
applications for that?
exactly. I'll give you one example. So in aviation medicine, pilots have to get medical exams pretty
Mm,
frequently, like every six
yeah.
months or so. And that's pretty stressful for them because if their blood pressure is too high or, any other medical condition is discovered, that could potentially be disqualifying for them. And so a lot of or even non-pilot patients will come into their doctor's office really, really stressed out, whether it's because they're worried or they just couldn't find a parking spot or they're running late or there's a lot of family stuff going on. And so the second a patient walks into the doctor's office, take their blood pressure. And so a lot of times that blood pressure is artificially high. And that's not their actual normal resting home, non-stressed blood pressure. So if we're able to take a blood pressure on a patient frequently while they're at home, just going about their business and not thinking about the fact they're getting their blood pressure taken, we get a much more realistic picture of what their blood pressure actually is compared to, those like stressful moments running into the doctor's office, running late and worrying that it's going to be too high.
Yeah. And I can see that could be very circumstantial, like in the moment, and it's not as accurate, give you a complete picture of what's maybe going on.
Absolutely.
Yeah. And looking at like industry shifts, is there anything else on the market today, kind of like what you're working on, or it sounds like a very unique solution?
There's a lot of different devices and different methods available. So, sort of the standard of care is the blood pressure cuff, which I'm sure all of the listeners are familiar with. There's also an arterial catheter, which is a catheter that's inserted into an artery directly with a needle. And that's what's used most often in ICUs and surgery suites because it's the most accurate, continuous way to measure blood pressure. But obviously, we're not going to stick a needle in somebody's artery and have them walk around outside and going to the grocery store. And it comes with a lot of risks of infection and bleeding and other things. So those can't be used practically. So over the last 50 years, there have been several different methods developed to try to measure blood pressure non-invasively, like a blood pressure cuff, but continuously, like an arterial catheter. And so one of these methods is volume clamping. So there's definitely commercial devices on the market for this, but it goes over the tip of the finger. And for really sick patients, your blood vessels tend to clamp down the further out they are from the heart. So in the sickest patients, it doesn't work very well. And also, you can't really walk around outside with something over your finger and strapped to your wrist. It's just kind of cumbersome. So additional methods have been developed based on photoplethysmography. So like the same type of technique as a pulse oximeter that measures your blood oxygen saturation. And those are interesting, but a lot of them require calibration because they can't determine sort of the actual underlying blood pressure. They can detect trends in blood pressure over time. And so what really sets resonance sonomanometry apart from all of these other methods is we don't have to calibrate. You don't have to put on a blood pressure cuff or an arterial catheter to figure out what the actual blood pressure is before you can use it. You can just put on the device. It tells you what it is. And because it works on any artery, it gives you a lot more flexibility for different use cases, whether that's in the hospital or at home or on the side of a mountain.
Yeah, that's really clearly unique device that you guys are working on. What's the size of it? Just out of curiosity, is it big or something like it sounds like very mobile that you can carry with you?
Yeah. So the first prototype was kind of like standard ultrasound size. So obviously not very portable. But now we have it down to an armband. The
Wow. Okay.
actual reusable part is about the footprint of like a credit card, maybe a little smaller than that and like a little bit taller. So maybe like that tall.
Okay. So
So
kind of like a
something that you
mobile
could
charger or
easily
something.
wear, yeah, under clothing. And then we intend to miniaturize it even further so it just fits into a wristwatch, for example, or like an adhesive patch.
Yeah. And looking at current results right now from what you're working on, it sounds like things are going really well. Is there anything specific that kind of stands out in your mind that you would never want to lose in this process as you're working through this and developing?
Well, it's definitely been a process. I think it's something where we've had to look really critical at the date, really critically at the data and the results that we have gotten over time to sort of lead us into the direction with the solution that we currently have. So, we could have adopted some of the methods that required calibration, but I'm an ER doctor and I was kind of like, I don't have time for that. If I have to calibrate to another device, I'm just going to use the other device. Like, I'm not going to waste the time to put something else on. And so I think we've really had to be honest with ourselves about what's working, what's not working, and be willing to abandon a method and just move forward from that if, it was something we felt like wasn't going to be effective for the use cases that we wanted it to work for.
What's been harder than it should have been, or something that you've been trying to work through, but maybe you just can't quite break through that barrier? Is there anything like that you guys are encountering right now, or have you kind of worked through those things?
Yeah, I feel like, over the last few years, it's been a new thing almost every day. You have
Yeah.
a plan in your mind for what you're going to do and then a problem crops up and you have to develop new solutions to solve those problems. And so I think our team has been incredibly effective in being able to identify those problems, develop solutions and systematically kind of solve them. And so, yeah, I mean, when you think about ultrasound, for example, in some of our early studies, I mentioned we had sort of just a handheld ultrasound, and the engineering team and I were collecting a lot of the data, and just holding your arm in place for 30 minutes of data collection is really hard. So that really motivated, I think, everyone on the team we have to do this so it's automated. So you can just put it down, have it track the artery automatically and find the artery automatically and not require someone to hold something in place. And so, I think it's just been a process like that where something pops up. We figure out what we want to do and then sort of set out the plan to solve it.
As far as looking at the vision, where you guys want to take this in the next 6 to 12 months, like paint me a picture. Where do you guys want to go?
Yeah, so right now we have our pre-product prototype. And so I think what we really want in the next 6 to 12 months is our final prototype or our final product, excuse me, and to get it onto the market. So excited about that.
Yeah, I'll definitely be keeping an eye out. I'm sure the audience will as well. And where can people connect with you, learn more about the device and the things that you and your husband are working on?
Our website is esperto.health. And then I'm on LinkedIn, Instagram, all that stuff.
Excellent. Well, thank you for your time today. It was a wonderful discussion.
Thank you so much. I really enjoyed talking to you.
You as well.